Elaine Perlman is our next speaker. Anyone that knows her knows that nuclear Geiger counters go off when they get too close to her. So much energy and effervescence. She's the proudest vegan I've ever met. In her biography that she sent, she pointed out that she's painted 11 school murals, which only begs the question, what do they look like? And I would love to go see all 11 of them. As an endurance athlete, when I get into a conversation with Elaine, I am winded. And I feel that of anybody in this room, a century from now, Elaine is likely to have the most tall tales told about her, like she's a modern-day Paul Bunyan. But formally, she is the director of Waitlist Zero, an advocacy group that seeks to end the kidney shortage, but she does so much more than that. She's a Johnny Appleseed for living kidney donation. She founded One Kidney Club, New York City. She handles Ask Me Anything sessions for the National Kidney Donation Organization. She wears sandwich boards into the subway system here that proudly declares that she's a kidney donor and to ask her about it. And probably most tellingly and importantly, I've never heard anyone gush so much about her own son. So I am excited to welcome to the roster up here Ms. Elaine Perlman. Thank you so much, Elaine.
Hi, everyone. Johnny Appleseed and Paul Bunyan. Those are two of my favorite folklore heroes from elementary school, so thank you for the comparison. So my name is Elaine Perlman, and I am the director of Waitlist Zero. I feel honored to speak with all of you today about what I've learned about policy and legislation that impacts living kidney donation. I'll be taking all questions in my breakout room that follows our lunch with Cody Maynard and Ned Brooks. 6 months after my son, A.B. Roehrig, donated his kidney to a stranger, I did the same. My donation at New York University Langone Hospital, just 10 blocks south of here, launched a national kidney registry chain for 4 people who got kidneys. My kidney flew from New York City to Georgia. Another one went to Oklahoma, and then 2 more went up to Washington State. And so as you can see, that creates a geographical smile in the United States. Since my husband, Len, is surrounded by 2 kidney donors, he likes to say that we get votes in the family based on the number of kidneys we have. Donating my kidney to save a life has been a highly rewarding decision. Today, I would like to emphasize 4 major points. Number 1, our kidney shortage is deadly and getting worse. The needless suffering due to the transplant shortage is enormous. More than 40,000 kidney failure patients who could have been saved by a kidney transplant if we had no shortage, instead die prematurely every year. 40,000 annual deaths means that 110 Americans die each day from the kidney shortage. The most commonly quoted figure is that 12 people die each day from the wait list. And of course, that is true. That's 4,400 who die directly from the wait list annually, 4,400, and 10 times that, or 40,000 overall, from the kidney shortage annually. If we had enough kidneys, those 40,000 people would not die a premature and very difficult death. Can we solve this by fixing the deceased donor organ system? 60% of Americans are registered as deceased donors. But even if every one of us was registered, it would not supply us with enough organs to end the kidney shortage. Number 2, why do we have such a small supply of living kidneys? The cause of this kidney shortage is a prohibition on compensating donors that was written into the 1984 National Organ Transplant Act, also known as NOTA. For every person who is prevented or discouraged from donating a kidney, an American dies. Number 3, every time a person is saved by a transplant, over $400,000 of taxpayer money is saved because transplant is far cheaper than dialysis. So we can share some of these savings with donors. Since we taxpayers are saving over $400,000, we can afford to compensate donors. Number 4, and the most important of all, no arguments exist against compensating donors that can justify all of this tremendous suffering and death. The kidney shortage is a killer, and those who are making money from this shortage don't want us to change a thing. How much are taxpayers spending on end-stage renal disease? The number is enormous. Annually, $56 billion. With our federal budget of $5 trillion, 1% of that goes to pay for Americans with end-stage renal disease. That's $1 out of every $100 from our government's budget. I've been an educator for decades. As a teacher, I encouraged my students every step of the way to seize their education and build a better world. Since March of 2022, I left my position as a professor at Columbia University and a program director and shifted my focus. I am now teaching those in the transplant world that the kidney shortage can be over if we make better choices. I view this as a step toward doing what I ask my own students to do, which is build a better world. So let's talk about what happened in 1984 that has led to all these preventable deaths. Back then, the National Organ Transplant Act, NOTA, was passed, and it was written by then Senator Al Gore and his assistant Jerry Mand, a Harvard professor who I spoke with last week. NOTA forbids anything of value to be provided for those who donate living organs like livers or kidneys. Let's hear the NOTA law's exact language. It shall be unlawful for any person to knowingly acquire, receive, or otherwise transfer any human organ for valuable consideration for use in human transplantation if the transfer affects interstate commerce. The punishment for paying for a kidney, liver, or any other living organ under NOTA is a 5-year prison sentence and/or a fine of $50,000. As long as NOTA remains unchanged, tens of thousands of Americans will die annually from the kidney shortage. 89,000 people are currently on the kidney transplant waitlist. Even though this number is enormous, so many who medically qualify cannot get onto the waitlist. What are the obstacles? Those who lack money or a caretaker will likely be excluded. Cash is needed. One of my friends from rural Pennsylvania was told by the transplant center that her family needed to raise $25,000 to cover their costs, or her transplant center would not add her husband to the wait list. Another obstacle is that many kidney disease patients do not have a full-time caregiver who is strong enough to help with the recovery after surgery. This too prevents potential kidney recipients from joining the life-saving wait list. Once a person is on a wait list, the likelihood of receiving a kidney is low. In some states, the wait list is 10 years long. Half of those who go on dialysis die within the first 5 years. For them, waiting 10 years is not an option. And it's important to note that dialysis drains a person of vitality and has been described as a living death. In addition to these issues, so many potential kidney recipients are never even properly educated by our medical system about the benefits of transplantation. One reason is that dialysis centers earn about $100,000 per patient per year and are largely responsible for educating patients about transplantation. It has been said that this is like giving McDonald's the responsibility for our nutrition education. Let's back up for a second and remember that in order to qualify to donate, the person needs to be in top physical shape. That is why living donors live on average longer than the general population. We are approved because we are healthy. How many healthy Americans are healthy enough to donate their organs? Good health is becoming more and more rare in the United States. How many of us are overweight or obese? 80%. How many have prediabetes or diabetes? 50%. How many of those aged 20 to 40 have fatty streaks in their arteries? 85%. Fatty streaks in the arteries are a sign that kidney and heart disease are likely going to be diagnosed in someone's future. These numbers of widespread ill health indicate that few in our population are healthy enough to pass the transplant team's rigorous standards and be approved for donation. With so many unhealthy Americans, we are already working from a small pool who are able to donate. Willing donors have made peace with the pain of the surgery and the time commitment for testing, surgery, and recovery. But the moment that potential donors learn that there is a financial cost for them to donate, many of them remove themselves from consideration. Does it really cost money to donate? Living donors spend on average 10% of their annual salaries in order to donate. Though our medical costs are covered, donors pay for their own travel costs, to and from the transplant center, lost wages that are usually between 2 and 6 weeks, and dependent care. After interviewing living donors about these costs, I found that among them, the cost ran from $4,000 to $15,000. 30 years ago, the government created a federal reimbursement exclusively for low-income donors. Now, to be clear, I'm all for reimbursing low-income donors, but I also believe that middle and high-income donors should not spend a penny to donate. In response to an obstacle created by the federal government's reimbursement system, my organization, Waitlist Zero, is currently advocating for a bill called the Honor Our Living Donors Act, also known as the HOLD Act. Why? Because on the application to be reimbursed, both the donor and the recipient's income must be low. The HOLD Act's exclusive aim is to remove the recipient income from the application for government reimbursement so that only donor income is examined. Including recipient income is an obstacle to donation, stops potential donors from donating, and leads to the death of Americans. I am working on passing the HOLD Act with the help of 3 magnificent medical doctors. So far, we've had 22 congressional office meetings about the HOLD Act. Who are these medical doctors? Dr. Harmony, an emergency room doctor who gave his kidney to a stranger and is an NKDO mentor, is one of them. Dr. Peters, an eminent transplant surgeon, professor, and medical leader who has served in 3 wars, is the second doctor. And Dr. Hess, a physician, renal researcher, and health economist whose own potential donor removed herself from becoming a donor because she was rejected by NALDAC due to her high recipient's income, unfortunately could not donate. But the great news is that a non-directed donor came forward. 4 weeks ago, Dr. Hess was transplanted, and he's just been an incredible advocate for for supporting the HOLD Act. He's in his 4th week of recovering from his transplant and doing great. This past week, Doctors Peters and Hess joined me for 12 congressional meetings. And where is Dr. Harmony? He has been busy being the doctor for those NKR climbers who are summiting the 50 peaks in the USA to show the world that having 1 kidney does not slow us down. Please keep in mind that NALDAC's maximum reimbursement per donor is $6,000, even if someone donates both a kidney and a liver, and that is illogical. Not much legislation that supports kidney donors has passed since the 80s. Looking at today's legislative landscape that relates to living organ donation, I feel encouraged that bills are being presented in the current Congress. Very likely to pass is the National Kidney Foundation's Living Donor Protection Act. That bill has two goals. It forbids life insurance providers from discriminating against living donors and provides Family and Medical Leave Act protections for living donors. As a member of the National Kidney Foundation's Community Advocacy Committee, I went to Washington, D.C. this past March to persuade members of Congress to pass the bill. We are all optimistic that the bill will pass this legislative session, which ends in December of 2024. What else? Representative Matsui's and Wilson's Bipartisan Organ Donor Clarification Act would remove recipient income from the government's application. That is exactly what the HOLD Act is trying to accomplish. In addition, this act would enable a pilot test of incentives. Waitlist Zero is a signatory on the community letter of support for this bill, and we are hopeful that it will pass. Another initiative is the Living Kidney Donor Support Act that will create a national living organ donor infrastructure that will aim to increase the number of living donations and remove the inclusion of recipient income, the aim of the HOLD Act again. Fortunately, living kidney and liver donors can be reimbursed through other programs, like the National Kidney Registry's Donor Shield. That program reimbursed me for my own costs. I believe I was the first NKR chain launched from the NYU Langone Hospital right after they joined NKR. What else do I think needs to be done to dissolve obstacles to donation? We need all transplant centers to be willing to let those who are 18 donate, no matter if they are giving to someone they know or someone they don't know. In all transplant hospitals, an 18-year-old can donate to a family member or friend, but in too many misguided hospitals, donors who wish to give to strangers are made to wait until they are 25 to donate to a stranger. This reveals some of the prejudice against those who want to donate to strangers. Is there prejudice in the medical community against non-directed donors? Indeed, there is. The medical community only began permitting people to give kidneys to strangers around 20 years ago. Prior to this time, the medical community had thought that sane people would never do such a thing. But when we were psychologically tested, we were proven to be quite sane. We knew that we were born with 2 life jackets. When someone is drowning, we don't hoard. We share, and so we did. But to this day, too many in the medical community demonstrate their opposition to letting people donate to strangers by giving potential non-directed donors a very hard time. This manifests in some doctors discouraging patients, but discouraging potential altruistic donors by telling them it's a bad idea to donate. It also happens when transplant hospitals neglect to return our calls or follow up with us. As an NKDO mentor, I know that this happens too frequently. I tell donors to be proactive and persevere. This needs to end because people die as a result of this too frequent, reckless treatment of altruistic donors. As a result of the multiple factors I discussed, in the past 2 decades, the number of living donors has dropped 7%, while the number of Americans who need a new kidney has doubled. I want all Americans who could be saved by a new kidney to have one. I envision a future like the one we have for plasma. Without paying for plasma, we would have a shortage, so we pay. As a result, we have plasma abundance and export that plasma for cash to countries that forbid payment and therefore have a shortage. These are countries like Canada and New Zealand. Ned Brooks, the founder of NKDO, will very soon speak with you about the Coalition to Modify NOTA, an initiative that Ned, Cody Maynard, and I are working on. We see this as a David and Goliath battle. We are David, people who gave kidneys to strangers and are alarmed that we are not solving the kidney shortage, this solvable problem. Who is Goliath? All of those who don't want our deadly system to change. Sure, they are willing to tweak some of the systems, but that will not solve the problem. Expanding living donation is the only way to make sure that we save all who will die from the kidney shortage unless we compensate donors. If we all resolve to devote ourselves to ending this problem, we will. So thank you all for listening. And now comes some surprising and delightful news that I think will make all of us very happy. The news was told to me by Ruth Ann Leishman. That name may seem familiar to you because she was the representative from UNOS who spoke on the Freakonomics podcast with Professor Al Roth and Ned Brooks. While in the meeting with Ruth Ann, I brought up donors' anxiety about the new prioritization of donors. Fortunately, Ruth Ann assured me that donors would continue to be prioritized even though it's unlikely that we'll ever need a kidney because the transplant team would not have approved us for donation if we seemed to be at risk of developing kidney issues. Then Ruth Ann shared some great news. She said that in the new regulations, living donors will now be prioritized for the donation of any organ, not just a kidney. So, for example, if we donors need heart, okay, you can clap. So, for example, if we donors ever need a heart or lungs, we will get them quickly. This is a great new initiative that provides the kind of gratitude and reward that donors have earned. Every morning I wake up and think about the 110 people that will die that day from the kidney shortage. I feel anguish knowing that over 1 million people have died prematurely since 1984, 39 years ago when NOTA became the law. The number of the deaths is accelerating. In the next 10 years, 500,000 Americans will die due to the kidney shortage. Donation is painful. It takes time. But I want everyone who is healthy enough to consider giving this gift. I am so committed to spreading the word that I often wear a sandwich board around New York City that says, "Gifted my kidney to a stranger, ask me anything." Why am I such a fan of giving kidneys? I'm not alone. 95% of kidney donors would do it again if we could. Kidney donation saves hundreds of thousands of dollars. It's emotionally rewarding. And best of all, it saves lives. Let's treat donors as the treasure that firefighters, transplant professionals, and other lifesavers are. Let's reward us for our pain, our time loss, our gift, our commitment to saving lives. Let's unite and support legislation that helps us greatly increase the number of living donors. We need to incentivize people to save lives, just like we incentivize firefighters to save lives. We only need to do this until we have a non-human replacement for a diseased kidney. When we have solved the kidney shortage, we can all awaken each and every morning knowing that not one of our American brothers or sisters will die that day or any day from the kidney shortage. Thank you.